It's 6 months since the first Covid vaccine dose was given, and now more than 68 million doses later, the government's target of giving at least one to all adults by August is in sight.
We're now on the final lap, inviting people in the last priority group to come and get their jabs. So we'll be asking 3 million people aged between 25 and 29 to come in, get their first jab.
The final lap may be, but the Delta variant will ensure it's a sprint to the finish. More surge testing for the highly transmissible strain began in Berkshire today as cases continue to climb.
I now call the Secretary of State for Health.
But the Health Secretary had new numbers to show just how well those fully vaccinated are protected.
Our data show that of the 12,383 cases of the Delta variant, 464 went on to present at emergency care, and 126 people were admitted to hospital. Of these 126 people, 83 were unvaccinated, 28 had received one dose, and just 3 had received both doses of vaccine.
Reassuringly low numbers, but they won't necessarily stay that way with the new variant cases doubling every 8 days or so.
Still, only about half of adults have had 2 doses, which means, of course, that half haven't. And if you include children, and at the moment, some of the highest infection rates are in school-aged children, it's still only about 40%. So still, this new variant can do a lot of damage amongst the very large numbers of people who haven't yet got the protection of 2 doses.
It's why there are growing demands for the vaccine to be offered to children now that the Pfizer jab has been approved for those over 12. The Health Secretary says he's waiting on advice on the matter from experts, but while it might sound like a simple decision, it's not.
As you go down in age with COVID, the risks of the illness go down. So you've less and less to gain by doing it. So that there really does need to be an evidence-based decision that there will be a net benefit to the recipients of the vaccine before any decision is taken to roll them out. What's puzzling to me at the moment is that there are quite a lot of people who should know better, who are proclaiming certainty either in one direction or the other, without really taking into account all of the necessary evidence.
Looking back on the 6 months since Margaret Keenan's historic first vaccine dose, the programme had a massive head start against strains like the Delta variant. But will the rollout keep pace with the almost inevitable rise in cases we'll see in the months to come? Tom Clark, News at 10.